All right, we're taping now. Okay, if you could please each state your name and your affiliation and then the name of the app.
I'm Clara Grady. I'm from the college, and I study public policy.
I'm Dave Beiser. I'm faculty in emergency medicine.
My name is Priya Raja, and I'm an undergraduate in the college studying public policy.
My name is Leah Brodsky, and I'm an undergraduate in the college studying biochemistry, and we are Health Spotr.
How has this experience informed your understanding of mobile apps and app development? Oh, I forgot a question. I apologize. Good thing we can edit. Okay. Why did you enter the mobile app challenge?
Well, so why did we get involved in the mobile app challenge? Well, the four of us were actually working together in the D4 Innovation Lab, actually working on the process of hospital discharge. And we came together around my experience in the emergency department and frustration with emergency department discharge. And we thought, well, this is a really interesting kind of problem. Could we apply the concepts of human-centered design to this problem and come up with a reasonable solution? And as we were talking about this, the mobile app challenge kind of came onto our radar, and we decided, well, rather than kind of just study this in an academic sense, let's just fix it. And we're going to fix it using the process of the mobile app challenge. And so the rest is history at this point.
Very good. Okay. How has this experience informed your understanding of mobile apps and app development?
Well, the three of us knew nothing about mobile app development before coming in. Dr. Beiser he was an engineer before becoming a doctor, and so he had some experience in the tech world before. But for the three of us, it was completely new and very scary at times, just challenging. In many moments, we were just completely surprised by, like, something we thought was a small change. They would say, "Oh, that's a full day's work," and we just had no idea how things worked. And we learned a little bit of how to write in JSON, how to write in HTML, and very, very basic, but. We definitely learned a lot about how this process works, how to speak the language of developers, because it really is challenging at times to convey exactly what you want and in a way that they'll understand and be able to do it. So an amazing learning experience, all in all.
Okay, good. Was this your first time working through a technology development project? How do you feel about the process IT services developed?
So, yeah, this was the first time that we had worked through a technology or IT project, and it was really nice the way that things were broken down, I think, and the pace that it was done at. We were able to get things done a lot more quickly than I think we had been used to in our other academic experiences. And also just the different conversations that we have with people and the connections that it allowed us to have. I didn't even know that IT services really existed, and like going to the Toyota Institute and like all that sort of thing. That whole part of the campus didn't exist for me. So on a smaller university level, but yeah, so we just came to understand a whole different branch of what was going on in the school, and also just in the way that the world is working right now.
Okay. What was the most surprising or unexpected thing about this experience?
I guess what was the most surprising or unexpected thing about this experience are things that my teammates already touched upon. The whole process was really different for us. All of us come from academic research backgrounds where the process is very regimented. To do anything or to study anything, before you even begin to develop something, you have to go through a regulatory board. And then you have to go through a very structured way of talking to patients, and then a structured way of analyzing and understanding those results. And the process of developing a mobile application was completely different. Within 2 weeks of rapidly prototyping our app on pieces of paper, we walked into the pediatric emergency ER and we were talking to patients. And in the course of 5 weeks, we had talked to maybe 20 families, changed our app maybe like 30 times, and in the process of, from January to March, we had a totally different product, and, moving from March to now in May, we have an actually developed app, and how fast that process is and how flexible and open it is to change is something that's unprecedented, and I think it's something that none of us had really experienced before.
Okay.
So my phone went off like 3 times during the previous wonderful thing. Do we want to hit it again real quick, or is that fine?
How do you feel?
I think it's fine, unless
Okay.
you want to do it again.
Okay.
I'm just
I
afraid.
just hope it wasn't like distracting. I was like looking at my phone trying to get it
No,
to
we
shut
can
up.
zoom in. We can zoom in.
I think okay. Okay. What do you plan to do with your app now that the competition is over?
So we really enjoyed this project. It was a lot of fun, but we also really believe in its future, and we have plans to validate, develop, and integrate the app. So we actually are planning to do 2 research studies over the summer. So the first is to study what technology patients are using, and to see how we can, what platforms people are using and what features would be best suited to their needs. And the second is to actually test how effective the app that we created is. So then we have a lot more development to do. We came a long way with the mobile app challenge, but there are additional features that we want to add. And lastly, like, we want to get it out there. We want to get it into hospitals and get people using it. So that we have a long way to go, but Matt got us pretty far.
Cool. Is there anything else anyone would like to add?
Just add that it has been an amazing process. I think we've all just touched on about how it kind of took us out of what we had been used to doing, even though it still touched on what our backgrounds were, so it allowed us to apply something that we all were familiar with and really loved, and like show us another way to do it and like really have an impact with it. And so that was really cool, and we wouldn't have been able to do that without the kind of the structure and the people, resources, and all of that sort of thing. It's great.
And definitely, we're a very theoretical school, so
Yeah.
doing something that's very like practice-oriented was really refreshing for me, and I think for all of us.
And for me, actually bringing engineering into medicine, bringing those 2 pieces together was very satisfying. It's not something that is necessarily identified with the University of Chicago, so you don't think about engineering and the University of Chicago in the same sentence typically, and I think this process really kind of busted that myth apart.
Oh. Well, just learning how to speak with the developers was definitely challenging and really fun to learn how to do that, and I hope to continue learning how to, well, actually learn how to code and keep working on those skills. So.
Great. Thank you very much.
Can you just cut that last part out?
Yeah.
I didn't know that.